I'm Oladipo Aboderi. I'm a clinical microbiologist. I work at Obafemi Awolowo University in Ile-Ife. I'm the chair of National Technical Working Group on Antimicrobial Resistance here in Nigeria, and also lead the Antimicrobial Stewardship subgroup. I'm speaking on leadership and governance for antimicrobial stewardship. Now, the objectives of this is to understand what's the role of leadership and what are the expectations for leadership's healthcare facility leadership to support antimicrobial stewardship, as well as what's the kind and level of structures for governance for successful antimicrobial stewardship programs in healthcare facilities. Talking about antimicrobial stewardship, it's actually a priority for healthcare facilities because by definition, antimicrobial stewardships are a set of coordinated strategies to improve use of antimicrobials with goal of enhancing patient health outcomes. The primary reason why patients come to healthcare facilities is to get well and to improve. So it interests the management and leadership of the facilities to ensure this one, and using antimicrobials responsibly help to achieve this objective. So that's why it is a priority for healthcare management and leadership to give support and to actually provide the environment, enabling environment for antimicrobial stewardship program, and to see for the establishment and running of antimicrobial stewardship program in such healthcare facilities. There are essential core elements of antimicrobial stewardship programs, and for healthcare facilities, these have been summarized into 6 core elements according to guidance by WHO. And those elements are leadership, accountability, as well as the other ones. We'll be speaking to leadership and accountability in this presentation. So as we talk about leadership, the healthcare facility leadership, we're saying that the leadership, the management structure in healthcare facility should give priority and make antimicrobial stewardship a priority objective in such healthcare facilities. And stewardship program actually should be incorporated as a key performance indicator in healthcare facilities because it affects patient outcomes and what happens when patients seek healthcare in such facilities. Not only that, the leadership should also ensure that dedicated finance and human resources are allocated, expertise to drive antimicrobial stewardship programs in their facilities, and beyond that should also see that there is an acceptable action plan, time-bound action plan that specifies different interventions and activities and for antimicrobial stewardship in the healthcare facilities. So it's so important, and without that leadership, antimicrobial stewardship as an institutional effort cannot fly. But beyond that, the other ones would then be the structure, the governance structure that drive and that support and that seek to implement antimicrobial stewardship program in the different healthcare facilities. So number one in that structure is the Antimicrobial Stewardship Committee. Antimicrobial Stewardship Committee actually establish the strategy for antimicrobial stewardship in the healthcare facility and give direction to what and how to run antimicrobial stewardship in that healthcare facility. Definitely such committee is a multidisciplinary committee that provides direction and oversees the coordination of antimicrobial stewardship efforts in healthcare facilities. It also provides educational programs in such facilities and engage different personnel that are involved in antimicrobial stewardship program in the facility. Antimicrobial Stewardship Committee has this mandate to establish clear collaboration with another important committee in the facility, which is the Infection Prevention and Control Committee. Not only that, the Antimicrobial Stewardship Committee, it's also important to ensure that they oversee those who do the day-to-day implementation of antimicrobial stewardship program. That's the antimicrobial stewardship team. So the committee oversees. And not only that, the committee also identifies and work with AMS champions, that's antimicrobial stewardship champions in the facilities. They also interact with other healthcare professionals within the facilities that might need to be co-opted into the functioning and activities of the antimicrobial stewardship programs in the different units of the hospitals, who are not necessarily statutory members of the antimicrobial stewardship committee. Antimicrobial stewardship committee usually can be a standalone committee in the healthcare facility, depending on the available manpower, or it can be part of existing programs within the committees in the facility. If it becomes part of an existing committee, subcommittees like Drug and Therapeutic Committee, or if it's Infection Prevention and Control Committee or Patient Safety Committee, then the Antimicrobial Stewardship Committee would have to have a specific item on the agenda of that other committee to be able to push the agenda for antimicrobial stewardship program in the facility. And like I stated before, it's a multidisciplinary committee that brings together different healthcare professionals, everybody that are key to ensuring that antimicrobials, that we take responsibility to preserve antimicrobials as a public good for patients now and patients that will come years to come, and that these goods are available for use for foreseeable future. Not only that, the Antimicrobial Stewardship Committee see to the development of an action plan, like I mentioned before, for that committee that will be implemented over time in that facilities, and they review that facility. And it's also important that the committee also generates reports, regular reports of all the activities of the committee. It might be an annual report. And such reports will also include measures of antimicrobial use in healthcare facilities, both quantitative and qualitative measures of antimicrobial use in healthcare facilities. Membership of the committee brings different professionals, physicians, prescribers of antimicrobials in the facilities, pharmacists that dispense antimicrobials, nurses also, clinical microbiologists, where they are available. Epidemiologists in the healthcare facilities are also an important member, because by the time you now begin to measure performance, you need to look at the data. Specialists in IT, of course, we had already mentioned that the committee should have a link with infection prevention control. So in an ID system, there should be representation of the infection prevention control in the AMS committee. And of course, AMS champions that actually oversee day-to-day running of AMS program, antimicrobial stewardship programs, are essential core members of the Antimicrobial Stewardship Committee as well. Now, specific details about the terms of reference for each of these members that we talked about. The physician in that committee usually will lead the Antimicrobial Stewardship team that go around for implementation of the strategy that has been adopted for that facility. Usually somebody who is a specialist in infectious disease or a clinical microbiologist, and drive what are the strategies that have been adopted for the healthcare facilities. Both the core strategy, such as pre-authorization, prospective feedbacks, and audits, and not only implementation, like it also monitors performance of different interventions in the healthcare facilities. Then microbiologists or laboratory scientists, because the microbiology laboratory is key in the performance of antimicrobial stewardship, in identifying organisms, performing susceptibility testing, and making the results available, providing feedback and support. They are also very important members in this committee. Of course, the pharmacists are key members of the committee. They monitor distribution, dispensing of antimicrobials, stock, availability and to ensure that these drugs are available, and also measure the volume of antimicrobials that are available, antimicrobial consumption used in the facility, acts as a liaison between the committee and the drug and therapeutic committee. Nurses, we've mentioned, are also a very important member of antimicrobial stewardship committee, because they see to it that the antimicrobials, patients on antimicrobials use the drugs. Of course, before antimicrobials are used, they're also very important in ensuring that investigations are sent to the laboratory and that the results also inform interventions necessary for each of the patients that is under care. Other members of this, depending on their availability, you have IT specialists or data specialists that help to collect and analyze data on antimicrobial stewardship, and that helps also in ensuring that these are disseminated, because it's not enough to collect data. It's also essential to feed back data to those who can act on data, like the leadership of the healthcare facility, as well as getting this information beyond the local facility, even to state level where those structures exist, or to the national level as well. Those that run the day-to-day ward rounds, going to different units, implementing whatever strategy that has been deployed for stewardship, are the antimicrobial stewardship team. Now, what happens depends on what is available in each of the facility. It may so happen that the same set of people that do the day-to-day, they are also the ones that are implementing strategy, that is the committee. So if that is it, the important thing is that they understand that beyond defining what should be the strategy of the antimicrobial stewardship committee, they are also the implementers. So in which case, membership of stewardship, the team also overlap with that of antimicrobial stewardship committee. The essential goal of it is that antimicrobials are used in a responsible manner, and everybody, right from the top management to prescribers to dispensers to those who do tests, everybody takes responsibility to ensure that antimicrobials are available for as long as they are needed to treat infections and help to promote outcomes for patients with infectious diseases.